A 50-year-old woman undergo a total abdominal hysterectomy. BMI is 20 kg per square meter. Surgery was performed through a fenchtil incision and a self-retaining retractor. The operation lasted about 2 hours. The next morning, the patient falls down during getting out of the bed. During examination, there was absent patellar reflex. What is the likely injured nerve? What is the mechanism of injury? And mention 2 measures to prevent such an injury. Peripheral nerve injury occurring in about 2% of gynecologic surgery. Postoperative neuropathy may affect any of the nerves of the lumbosacral plexus or brachial plexus. However, the most commonly affected nerve is the femoral nerve. The femoral nerve originates from nerve roots L2, 3, and 4. It passes infralateral through the psoas muscle and emerges at its lateral border. It exits the pelvis under the inguinal ligament to enter the thigh. The femoral nerve provides sensation to the anterior and medial aspect of the thigh, as well as the medial aspect of the calf. Regarding its motor function, it provides flexion of the hip, extension of the knee, and patellar reflexes. The femoral nerve is the most frequently affected nerve during gynecologic surgery, with the incidence of at least 11%. The mechanism of injury is a prolonged compression of the nerve against the pelvic wall by retractor blades. Another mechanism during vaginal operation is a stretch injury due to inappropriate positioning of the patient. Motor manifestations include weakness or inability to flex the hip. This means inability to climb stairs. Also inability to extend the knee, and this means inability to stand from a sitting position. And the knee jerk reflex is usually absent. Sensory manifestations include paresthesia over the anterior and medial thigh, as well as the medial aspect of the calf. To prevent such an injury during abdominal operation, use the shortest lateral retractor blade available to avoid direct compression of the psoas muscle. During a prolonged operation, more than 4 hours, periodic relief of the pressure applied by the lateral retractor is recommended. During a vaginal operation, proper lithotomy positioning is important. This includes moderate flexion at the knee and hip joints, minimal abduction, and minimal external rotation at the hip.